My name is Lori Root, and I'm with the Nova Scotia Advisory Commission on AIDS, as well as a member of the Health and Wellness Diversity Committee. We will now begin the short presentations, and we have 4 to begin with. If you'd like to come up to the front, we have Sheila Bird, Hubert D'Entremont, Deanna Beck, and Alexandra True. So we will start off with the presentations. Each one will have approximately 10 minutes. And after the presentations are completed, then we will open the floor for questions and answers. Thank you very much for your time.
Hello. Hi, so I'm Sheila Bird. Hopefully everybody can hear me. I'm here from Eastern Shelburne County to talk about food security and health equity and the work we're doing there with our partners at Mount St. Vincent University around food security. So to start off, the reason why we're doing the work we're doing is because despite Nova Scotia's incredibly rich heritage of agriculture and fishing, our province actually reports some of the highest levels of food insecurity in Canada. Over 9% of Nova Scotians report moderate to severe levels of food insecurity, and we have over 20,000 people visiting Nova Scotia food banks every year, 33% of whom are children. So community food security is really about health equity, and it is a health equity issue. Community food security matters because it is connected to our health and vitality of our communities, and it means creating healthy, vibrant communities where there is self-reliance and social justice for everyone, and where no one has to go hungry. So the first part of work I want to introduce is a 5-year Community University Research Alliance in partnership with Mount St. Vincent University and over 60 different government, community, and university partners called Activating Change Together for Community Food Security. And this research project is really about engaging people in our communities to understand community food security, make connections, build relationships, break down the expert model, and learn from each other to build capacity at many levels for broader social change, and to break down the health inequities that exist around community food security in our communities. So Eastern Shelburne County, where I live and work and play, is one of the 4 communities that's hosting the food security assessments. And the food security assessments is a research approach really to understand what food security looks like at the community level. So it's everything from how our food is produced to the supports around food, and also focusing on people and populations vulnerable to food insecurity. It's about understanding the social inequities that exist around food insecurity from the people that are actually experiencing it. So one of the promising practices of the research project is really around the contribution to the evidence base. And these assessments will paint an incredibly comprehensive picture of food security, not just in Eastern Shelburne County, but in the entire province. The community members in Eastern Shelburne County are engaged in taking an active role in gathering and creating the evidence, and in having conversations around food security. So some of the work that we're doing in Eastern Shelburne County relating to another promising practice is certainly around community engagement. And what that is that's really important to empower all the people and groups and individuals within our community to have a voice, to be part of the story, to help us understand food security, to inform local healthy public policy. Also, we're building relationships and starting conversations with groups and target populations we haven't necessarily talked to before. At a recent community meeting that we had around food, I had a volunteer come up to me afterwards and said, "I can't believe it, I don't know anybody here," and that never happens in a small town. Intersectoral action is another promising practice that's happening on all levels, so at the university level and at the community level, in which we are trying to engage key partners and build relationships for action. So for instance, in Shelburne County, when we launched the research, we had a large multi-sectoral community event with over 40 different organizations and departments represented from 6 different sectors. So the group that formed is made up by diversity of people, including health, education, Department of Fisheries, our Family Resource Center, our Women's Center, and of course our community members. So the research really has been the vehicle that has driven the dialogue and engagement in our community around health equity and food security. But it is these conversations that are spurring action to happen on a local level, which is really exciting. We have seen people come together to form structured and unstructured groups to make things happen and create social change around food. These conversations and actions have brought together groups and individuals that have historically never worked together and are starting to see the real benefits of true community collaboration. For instance, one of the volunteer groups has worked to help gardens get started all over the community, including at the elementary school for the food bank and at a group home that supports people with disabilities. So things are popping up all over because of the dialogue that is happening. So whether it be the diversity of education levels, income levels, socioeconomic status, our practice is really to find common ground to have these conversations and engage and involve everyone. And of course, our second goal is around action and policy change to happen on the local level. So increasingly, we recognize that health equity exists when communities are food secure, which means no one is hungry, no one has to worry about where their next meal is coming from. It's when producers can make a living and when we have vibrant, healthy communities. We're really excited about the work that we're doing in Eastern Shelburne County, having these conversations and doing the research to truly embrace the diversity of our communities has really spurred action to happen to reduce social inequities around food and food security. Thank you.
Good morning, bonjour, bon matin. And thank you for the invitation. My brief presentation will illustrate for you one of the promising practices that we had the opportunity to participate in the area of Southwest Health, in particular within the Digby General Hospital setting. Within our vision at Southwest Health, you will find that we include integrity, supporting honesty, principles of ethics. Also, we include equity, so that we make sure that we are inclusive, equitable, also fair. We also include respect, excellence, and commitment. In my role as site manager at a small community hospital, I had the opportunity, I was approached by a group, local group, who certainly worked very hard in regards to meeting the needs of individuals who had challenges, personal challenges as well as professional challenges in developing some of the skills that they required in order to effectively be able to compete on the work market or the work field. So through the Digby Disabilities Partnership Committee, who approached us, they approached me if we possibly would be interested in participating in what they referred to the Youth Skills Workshop Experience Program. What does that all mean? It means that they had a group of individuals who had some already met a formal educational program, either at the community college level or at the university level. However, some of the skills that were required for them to be successful in obtaining jobs were missing. And when I refer to these skills, I refer to sometimes it was simple as some verbal, some other communication skills. Self-esteem, to be able to further develop self-esteem and really believe that, yes, I can. So the proposal was that for a 3-month program, we would accept within our healthcare facility individuals, youths, who had specific objectives to develop some of the skills that they felt that they would need to be able to go through a job interview with, the sense that, yes, I can do this, and also prove to an employer that they met those qualifications. So, challenges, of course, there's always challenges. I've been in the health field for many, many years, and I'm from probably the vintage that if there was something that needed to be done, you just say okay and go ahead and do it. And sometimes forget that you have to sign papers and stuff like that. Anyway, sometimes it's better to ask forgiveness and permission, but anyway, won't mention that here. It's being recorded anyways. So Anyway, after going through the process of making sure, yes, there is liability insurance because, of course, we have to protect our public. Clear understanding of the privacy issues, the confidentiality agreements, etc. So after all of that had been completed, and our risk officer had as much hair as I do, we went forward and went with the project. It was very successful because we were able to integrate some youth that when they arrived, basically one in particular, just the anxiety, the perception, I can't do this. But through a 3-month process to see them grow, develop their various strengths, and be able to certainly enrich the qualities that they had. Outcome, we participated in this program not only once but twice. And the interesting part is that one of the participants who went through that program subsequently applied and was the successful candidate for one of the positions that we had posted within our health district. So we were very proud of that, very proud of her, and she remains with us, and we're very, very happy with that. So the other outcome is that in recognition of the support that the Youth Skills Work Experience Project had from us, the Digby Employment Partnership nominated the Digby General Hospital for the Lieutenant Governor's Persons with Disabilities Employer Partnership Award. It's an award that is presented by the Lieutenant Governor with Persons with Disabilities. So from a regional, there are 9 regional winners, and we're very pleased to be recipient of that. So last December 2nd, I had the pleasure on behalf of the Digby General Hospital to attend the presentation. Also the pleasure of meeting Michael Landsberg, who gave a very, very moving presentation in regards to the challenges that he, as well as many other individuals, have had with battling daily challenges of depression within a very public world. That's our experience. Certainly, we're hoping that we'll be able to continue with this very promising practice. Thank you very much for your time. Merci.
So I'll be talking to you today about what's happening in Annapolis Valley Health. So basically the approach that we've taken is a team approach. So we are a small but mighty group. We look at the district as a whole. So we have representatives on our group from public health, inpatient psychiatry, library services. We have inpatient maternal child health represented. We have a human resources rep. We have myself from primary health care, and we have spiritual care. So our intent is to try to integrate and connect our work to everything that's happening. We don't want to just have like the diversity work in one little bubble. We want to have it basically embedded in the system. And we've defined definition, we have a very broad definition of diversity. So I don't normally read slides, but I do want to read this one to you. So to us, diversity means being inclusive and respectful of differences. So this includes, but is not limited to, differences in age, ability, culture, ethnicity, gender, religion, sexual orientation, and socioeconomic status. So this list is by no means exclusive, but it's used to help demonstrate the broad scope of diversity. So why did we go that route? For a couple of reasons, actually. If you look at our stats or our data, I think you should be able to just get, just with the bars, an idea of what we're talking about. In Annapolis Valley Health, our demographics are, we have basically about 95.6% is Caucasian, and we have, it's in the high 90s, is English speaking as a main language. So we wanted to define diversity broadly in order to recognize the totality of the issue. And if we were fearful that if we went with diversity as being just around ethnicity or language, that our staff would look at that and say, well, we don't have an issue. You know, when you look at this, it could be a homogeneous population. So even though we may have 96% are Caucasian, doesn't mean that 96% people are all the same. So we went with a very broad definition, and that's been really the basis of all of our messaging. So we have two main outcomes as part of the committee. And basically, it's looking at, right now we're targeting our internal staff, so the AVH community, so everyone associated and affiliated with Annapolis Valley Health. So we have staff, patients, families, significant others, physicians, volunteers, community, and our partners. And basically, we want an intended outcome that everyone is treated with respect and is understood and comfortable in their environment. And we also would like, in order for this to happen, staff need to be equipped with the resources to create a welcoming and inclusive environment where diversity is respected, embraced, and valued in everything that we do. So how are we doing this? So we have a lot of supports in place, actually. We have direct support from senior management. We have time factored into my job description to provide a leadership role with our committee. We have very passionate members, which makes a huge difference for anyone who's ever been working on committees. If you have people who are really keen on being there, you get a lot more done. We have been focusing internally initially. We've been using best practice and gold standard to guide our work. We've borrowed extensively from the National Quality Forum information on cultural competency, and there's also a great resource out of Alberta Health Services. They created a directional document a few years back, so we've been using a lot of that. We developed terms of reference to guide our work. We have monthly working meetings, so when we get together, we actually plan a good chunk of the agenda to get stuff done. So it's not just updates, we actually factor in working time. We've developed an action plan with timelines and intended outcomes. And as I mentioned earlier, we try to link our work everywhere possible. So what are we doing? So we have a number of different initiatives on the go. We have a diversity and social inclusion educational module. We developed it a few years back, and we incorporated it into our Building a Better Tomorrow Together education sessions. And then provincially one was developed, so then we borrowed a few segments from that into ours. We are also in the process of creating an e-module on diversity and social inclusion. Our iceberg work, which I'm going to show you a visual in a second, has been a huge piece of what we've been doing. It's been a way to try and promote self-awareness and assumptions that we all make on a daily basis. So through funding through the Department of Health and Wellness in previous years, we were able to produce plaques that we have put up in each of our sites throughout the district. And we've been able to produce them in French, English, and Mi'kmaq. So each of our sites has 3 of the plaques. We have a 3rd annual spirituality and diversity workshop coming up in a couple of weeks, actually. And the theme this year is creating hospitable spaces in healthcare, so building healthy relationships. We have a memorandum of understanding working group with representatives from our Bear River First Nations and our Annapolis Valley First Nations. We have a French language working group. Our diversity work in general fits within our respectful workplace policy. It links to our universal competencies and our population health work. We're in the process of implementing a procedure protocol, it's not really a policy, but for interpretation and translation. We're linking with South Shore Health. A member from their diversity group sits on our group so that the sharing can go both ways and learn from each other. And we're looking to link with community diversity work. There's an active group in Kings County right now, and that's on the horizon for us to link with. So I'm not sure if the wording on that is clear or not. So that's the basis. That's obviously the English version of the iceberg. But the messaging behind that is that a lot of what makes a person is under the surface. So how we make decisions, what our values are, things that you can't see when you first meet someone. So a lot of the messaging around that has been take the time to look below the surface to really find out what makes people people. So thank you.
Hello everyone, my name is Alexandra True. I work for the Cumberland Health Authority, and I also have a presentation. Thank you very much. So in Cumberland County, we have just over 32,000 people, and in that population, we have identified over 20 different religious groups or faiths or cultures within just that very small group. So obviously for Cumberland County, diversity is an extremely important aspect, especially in healthcare, because all of our CHA employees encounter different members of those cultures on a daily basis. So being able to understand and relate to those cultures and different socioeconomic statuses is very important. So the Cultural Diversity and Social Inclusion Committee has been working for the last number of years on educating and providing just information and trying to be more open to different cultures within our DHA and in our community. So here you can see a picture of our diversity boards. These are to showcase different diverse cultures in our communities. And right now we have, this is up at our Cumberland Regional Healthcare site, and it's showcasing both African heritage and Aboriginal cultures. And this is actually just at our emergency department, so everybody who comes in for outpatient sees it, which is really cool. So in March of 2012, we applied for a grant through the Department of Health and Wellness, which was two parts. The first part was to create this calendar here, which was themed Days for Diversity, or of Diversity, sorry, making every day count. It is a little hard to read from here. And then on the back, we showcased our community profile, which came from the 2006 census data, and it showcased just the different cultures and statuses within our community. And of course, there's much more inside the calendar. The second part of our grant was to create, or to host, a diversity showcase event. And shown here is the group that was part of the planning committee, or was the planning committee. I'm not going to give all their names because I'm sure I'll forget. But we worked closely with members of the Aboriginal First Nations Committee and Community, and CANSA in order to create an event to celebrate both Aboriginal First Nations cultures and African Nova Scotians. So here you see Darla McPherson, our VP, and she was introducing the First Nations presenters for the event. This event was hosted on October 12th in the lawn of the Cumberland Regional Healthcare Center. It was in the back. We rented a tent and staging and everything throughout our community, which was great because we were supporting local. It was very cold, unfortunately, so we had to get heaters halfway through the day, but we were able to fix it. All right, and I'm getting a 5 minute. So the first part of our event showcased Aboriginal culture. We invited the All Nations Drum Group, and shown here is a member of that group presenting. And she also presented on traditional medicines and herbal remedies with known within First Nations groups in Mi'kmaq. This was a smudging ceremony, which was incredibly exciting because she was actually able to invite our participants to participate in that ceremony. So we were able to actually be a part of that, which was very cool to see. That's me there. And this is the drum group setting up their drums. It was an incredibly joyful and very spiritual experience to see. Everyone who was there was very moved by this presentation. This is them doing the smudging over the drum. And we were honored by the group to actually participate and play with them, which was just incredibly moving and very exciting. And they explained what some of the songs meant and why it was, like, when they would be used, etc. For the event, the Cultural Diversity and Social Inclusion Committee decided that we wanted to showcase both medicines, music, and food of these two different cultures because those are such big parts of culture that identifies with them. So we decided to have the event catered by Jeannie's Catering Service in town, and we were able to have foods from both cultures, which included chicken wings, mild and hot, which were great. We had rice, we had beef with tomato sauce, curry chicken, smoked salmon, bannock bread, and we had a blueberry dessert, which was excellent. So this is everybody. Here we had the second half of the event highlighted the African Nova Scotian culture. And it was a musical journey through the roots of the African heritage. Here, and shown here, was the traditional African drums. This was a presentation by, and I apologize, I don't have their name here, but it was an excellent presentation. They went through and played some of the songs and kind of talked about how drums in Africa traditionally were kind of used like cell phones to communicate between the different villages. It was a really fun presentation to watch. And we had some of the children from the African Children's Choir dancing around that, which was really cool. And then we had Ms. Liz, who is a local hip-hop artist in our community, and she presented some of her original songs, and she had her cousin Caden Cook present with her, which was really fun to see. And this here is actually Tony and Susan Robichaud. They're local jazz artists, and they presented some beautiful jazz songs to just kind of guide us through that part of Canadian Nova Scotian music and heritage. And this is Bruce Gibson, who also did a blues presentation, which was fantastic to see, and he does a lot of benefits, so he walked us through that journey. And then we ended the event with the African Children's Choir from Moncton, New Brunswick. And they had us all dancing up, which was great because we were freezing by this point. And they were able to do some of their songs. Throughout the event, we had approximately 30 to 60 people in the tent at all times, when we estimate that there were about 200 people who were actually present over the entire 8-hour event, which was really, really exciting to see. And almost everyone who came expressed an interest in hopefully having an annual event where we would highlight or celebrate different cultures in different years. So hopefully we're able to get the funding for that and do it again.
Thank each one of you for sharing your promising practices with us. We'd like to open up the floor to questions.
I'm Jim Guthrow. I'm a consultant with the Continuing Care Branch of the Department of Health and Wellness. Kudos, folks. Great work that's being done in your districts throughout the province. My question is from a sustainability perspective. In relation to the information you mentioned today, how do you look at or foreseeing sustaining the work that you've done 2 years, 3 years, 5 years down the road?
We actually have a legacy draft for discussion, so I certainly can provide that with you if you're interested. But our project is a 5-year project, so it takes us into 2017. And we have some, achievements we have to accomplish, we're hoping to accomplish by 2015 in terms of the research. But what we're seeing already, it's just started, it's been about a year in, and what we're seeing in our communities is that because the research is happening in the community, and we're taking ownership of it there, we're really just being able to build things in our community by ourselves, and it's really exciting. People want to talk about food, they want to build gardens, they want to do things on the local level. So those are the things that are going to be around forever. So even after the research is done and over with, there's still going to be kind of that legacy around food, and certainly our ultimate goal is around policy change, so that can absolutely make a huge benefit, long-term benefit. So.
From our project's perspective, sustainability is not a challenge due to the volume of candidates that so far have asked to participate. Also, we have significant buy-in from our staff, and that is very, very important, and obviously has a major effect on the sustainability of that. So we're quite positive that we'll be able to continue to collaborate in these types of programs, which certainly will help those individuals in the community, as well as help our needs within our district.
And with us, basically, it comes down to trying to integrate it and embed it everywhere we can in the district. So linking it to orientation of new staff, connecting it to the universal competencies, which are part of our performance appraisal process. So, and then linking it to the respectful workplace policy. So having it in those different areas increases the chance of sustainability.
And For us, even though our event was really a one-off, and if it doesn't happen again, that'd be very sad, but it's okay, because we have purchased those boards that I showed you at the beginning. Those have been placed around throughout our district, and they are being rotated with different cultures throughout our community, and different groups that would like to represent information or educate the community on what they do and why they're important. So everyone in the public can see that, and the community health boards are actually supporting those also. So if they do fall off the bandwagon, they'll fill it with all the wonderful work that they do. So we're able to educate and support our different cultures in our community that way.
Thank you.
Hi. Again, what James said, kudos. It's great to see such promising practices. Question for Deanna. How much community engagement and participation have you had in the work, and how are you planning to move that out into the different demographics that you identified?
So our focus right now for the last year or so has been mostly internally on staff. But having said that, like I said, there is a very active group in Kings County, and we've been involved. They've been having annual forums that we've been attending, and then most recently they actually developed a diversity and action plan for the next couple of years. So we're in the process of linking up with them because there's a lot of things in their action plan that overlap with ours, and so just trying to see how we can mesh that and basically share resources and move the work forward. So there hasn't been a super amount of community engagement, simply because it has been an internal focus. But that's one of our longer term plans that I guess we wanted to get our own, what's the saying, our own house in order first around, you know, this is what a respectful workplace is. This is how we interact with each other. This is how we interact with patients, and then take that messaging outside. So does that answer your question?
My name is Andrea Papin. I'm a researcher at the Atlantic Center of Excellence for Women's Health. Deanna, my question actually was related to one of the slides you put up, that graph. But Sharon, I think my question is more for you. I was curious, and I don't know if Malcolm Schuchner is here. Is Malcolm Schuchner here? Yeah. Okay. I'm curious to know if we have quantitative data around different statistics around diversity that is collected on a regular basis, and if that data exists in a website that we can use in creative ways to share with people, because I saw your graph and I saw that it indicated, what prominently people think and why we have to move outside that boundary. But what I didn't see was the other view, which was, in fact, there is all this diversity. Because in your presentation, I'm sorry, I can't remember your name.
Sorry, it's Alex.
Alex, in your presentation, you immediately talked about the diversity in your area, and it would have been great to have a sense of kind of what that diversity looked like. And I was just kind of drawn to the notion of, wouldn't it be great if we showed kind of one graph but immediately could show another, and that there was on community accounts a baseline that showed in some way visuals of what diversity really meant, and that the definition wasn't just ethnicity and culture, but all those other dimensions. And I didn't know if we collect any such data, if that's allowed to happen, and if we do, can we do that? And can we create a website with community accounts that does that, please?
So no question.
Yeah. Well, I mean, we're talking about promising practices. I'm just curious.
Okay, I have a couple of comments.
Okay.
So we do have more data. I just stuck that slide in there just to kind of show why we went with a broad definition.
Yeah.
We have that from, I think that was from Stats Canada through the census.
Yeah.
And there isn't a whole lot. I mean, we have some data on Aboriginal status, African Nova Scotians, but we don't have a lot. And then we've actually had the conversation at our committee around what data is being collected, because
Exactly.
through the Meditech, for example, and we've had some conversations with our experts in that area. And because I know right now, even when language is asked, it just says, I think the options were English, French, Mi'kmaq, and other. So there's a huge other, that isn't necessarily being captured.
Yeah.
And then, yeah, exactly, like all the other aspects of how we're different. Is that being captured? I don't know. Can it be captured? I don't know about that either. Like, you know, from an ethical perspective, how do you, because gender was another one that came
Sure.
up. Like, how do you, I think the options right now are male, female, and other on
Yeah.
Meditech.
Versus the continuum of.
Exactly. Or enabling people to self-identify. And so, yeah, it has been a conversation at our committee. And
So maybe we could do a pilot study in a community and do a baseline, and then maybe it could be replicated all over the province. Wouldn't that be great? I don't think it would.
Who am I to argue with that?
Yes,
I
exactly.
argue with that, right?
Yes.
So in terms of data, I think everybody can hear me. In terms of data, no, I have to speak into the mic. So in terms of data, I think you might call me the data girl, because I have been advocating for identity data since I can remember. So we work toward that. What the possibilities are for you to name, as you have, and certainly there is no ethical reason why people can't self-identify. There is no human rights reason why people can't self-identify. It's self-identification, which means that you have the choice whether to identify or not. And with community counts, I think that they basically take what is available through census and you know, provide that. But the opportunities are there for more, and certainly we, as I always say as my refrain, we ask people to self-identify as students going to school in terms of their identity. We ask people to identify in order to capture data for employment equity. So it's not like we're not asking, and it's not like people aren't self-identifying already. So will that do for now? Thank you. Okay.
Is there any more questions? Very good questions. I can't wait for the table discussions. Again, I'd like to ask everybody to give them a round of applause for their presentations on practices.